And that could be from bone marrow or it could be from fat cells. And I'll explain both those in a second. Umbilical cord Wharton's jelly is the cushion within the umbilical cord. It's the richest source of mesenchymal stem cells that we have in our bodies. Amniotic membrane has no stem cells. But amniotic membrane is rich in growth factors, rich in messaging cells. Remember, it's the immune system that's communicating how do we repair. It's rich in anti-inflammatory cells, and it's richest source of scaffolding material to actually begin to build this new tissue on. Bone marrow aspiration, where they actually pound a needle into the pelvic bone and draw out marrow, and then spin it down, and then inject those stem cells in. It works, but it's also age dependent. Remember, as we get older, our stem cells, we have fewer of them, and they're not as viable as when we're little people, right? So it does have benefit to it. It's painful though. It requires recovery time. There's more potential complications when you stick a big old needle into somebody and pound it into the pelvic bone. You're asking for potential problems. The quality of the cells is age dependent. You can also take it out of fat. It's a painful process also. The FDA is starting to clamp down on this though, because in the process of spinning down these cells, they say it's too manipulative and it can damage the cells. So they're advising not to do it. So many companies are going away from that. We do not use bone marrow or fat cells, derived stem cells in our clinic. So bone marrow and fat are really not ideal. They do have benefits to them. There's no question about that. There's not as many stem cells as an umbilical cord Wharton's jelly. And the older we get, the stem cells are not as viable. They're missing key growth factors. Procedure hurts a lot, and it costs more. So there's more advantages. There's also a problem with surgeries though too, and it's very painful. There's 3 to 9 months of healing and rehabilitation. There's no guarantee of results. Failures and complications, and 50% of the people will need another joint replaced after the first one. The average cost for an uncomplicated case is now between $50,000 and $80,000. And sometimes it works and sometimes it doesn't. There can be infections, and you can't imagine the complications that we have seen come through our clinic. Because once people have complications, they don't want to go through it again. All surgery has risks, and this comes from the Journal of Orthopedic Medicine. There's blood clots and bleeding problems. Infections, 4 in 100 will develop an infection. And when that happens, for example, with a knee replacement, they have to take the knee joint, the artificial knee joint out again, put a shim in there, do antibiotic therapy for about 6 months while the person is in a wheelchair or a walker, and then reinsert a new one. Now there's not much room left in there once you have one knee joint replaced to do a second one, but they do second ones. But the third one is really, really difficult because there's just not enough material left.
He's got it.
Third one? Fourth. That's a record for me.
Well, when I had infection after the third one.
Okay. So.
And that's when I really had to have almost the whole knee and part of the femur and tibia replaced.
Yeah.
He has a hinge.
So it gets to the point where sometimes it leads to amputation.
Yep, that was next.
Yeah, okay. 1 out of every 400 will die in less than 30 days due to complications of a knee replacement.
Oh, great.
There's the increased medications.
Well, it did.
Right. So what are your options? Do nothing different. Wait. Longer you wait, the more degeneration will worsen, and that's often what the doctors will say. When it gets bad enough, come on in, we'll replace it for you. But in the meantime, there's nothing else that's really being done. More medications, more cortisone, surgeries, or you can turn back the clock of time with regenerative medicine. So there is advantages to the umbilical cord stem cells and amniotic membrane that we use in our clinic, and we use a company called Predictive Biotech. Predictive Biotech is out of Salt Lake City, Utah. I'm not here just to advertise for them. They're not paying me to say this. We're just using the best product that's available in the world. They use the University of Salt Lake to independently evaluate and quality control their products to make sure that what we're getting in our clinics actually will work. Here's the key to umbilical cord and amniotic membrane. There's no chance of rejection. These are what are called immune privileged. So, for example, the baby, the fetus, is protected by the amniotic membrane. Otherwise, mama's immune system would recognize it as a foreign object and mama would reject every baby. We wouldn't be here. Because it's immune privileged, the mama doesn't reject it, and therefore this is safe material to be injected into anybody without rejection. It's the best anti-inflammatory activity, growth factors, immune modulating capacity, and they have the optimum ability to stimulate regeneration. So where did this come from? These are all donated products, umbilical cord and amniotic membrane, from healthy moms who are evaluated at the beginning of pregnancy, all throughout pregnancy. Both mom and baby are evaluated after delivery. It's the safest and least invasive method of extraction that is available. So Wharton's jelly is rich in growth factors, messaging or communicating type cells, anti-inflammatory factors. It has some scaffolding material to it, but most importantly, it's the richest source of mesenchymal stem cells that have the capacity to differentiate into the tissue that we want it to. Amniotic membrane has a rich source of growth factors, rich in messaging cells, anti-inflammatory, but has the highest concentration of scaffolding material, so the repairing can actually take place. It's clean, it's safe, it's effective, and the fact is nothing is left to chance regarding safety. Here's the question that everybody asks. Does insurance cover this? There is no coverage for stem cells in the United States or any place else that I know of in the world. Insurance does not cover wellness care. I'll explain this in just a second. But stem cell therapy can be less than the cost of copay and deductible for replacement surgery. So here's why stem cells are not covered. This comes from Medicare Guidelines 2251.3. And all insurance companies kind of follow along with what Medicare happens to say. A treatment plan that seeks to prevent disease, promote health, prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration from a chronic condition is deemed not medically necessary. Makes you scratch your head, doesn't it? So here we've got this so-called healthcare system. It is not a healthcare system. This is not some public health service that we've got here. It's a medical industry governed by the pharmaceutical industry, the insurance industry, and the medical monopoly. For example, we help people with medical weight loss all the time, and we help them make it a permanent solution by eating healthfully, the correct diet for them, and make it enjoyable so it's a long-lasting process. Insurance will not cover our services for medical weight loss. What does insurance cover when it comes to medical weight loss? Bariatric surgery. That's it. Shrink your stomach down to the size of a tennis ball through a surgical procedure, and that's covered. It doesn't make sense, I know it. But if you want to have health, especially from a wellness standpoint, you've got to begin to invest in yourself. And it's cost effective.
What is the cost of the thing?
I'll get to that in just a second. Because that's the number one question everybody has. People go, well, it sounds almost too good to be true, but I think I would like it. I would like anything other than this alternative that I'm looking for as far as surgery. Can I afford it, and is it going to work for me? That's really what people are asking. It's a very simple process. So again, national average for replacement of a knee is $50,000 to $80,000. Out-of-pocket expenses, if you've got insurance and decent insurance, it's $4,000 to $20,000. Nationally, stem cells are between $5,000 and $11,000 per injection. Because we are part of a national organization, we have buying power through Predictive Biotech, the best product that we feel that there is in the world, and we can get the injections for under $4,500. And so we just pass this savings along to our clients.
Hi, I'm Joel, and before I got my injections in my knee, I would be limping quite a bit. It felt like somebody's had an ice pick under my kneecap. And my knee, it was kind of a on-again, off-again relationship. It'd be fine for a while, but then all of a sudden it would just hurt for a few weeks. And it got kind of sickening. I'd go for a walk, and my neighbors would always ask me why I was limping, and I'd always say, well, it's wore out. And so that was the main concern. And I've got younger boys, and I was not able to keep up with them. I couldn't kick a soccer ball, mountain biking, water skiing. It was starting to hurt a little bit more, so I was actually backing off a little bit. So I wanted to get this done so I could keep up with them and just enjoy my life more. I tried doing glucosamine. I tried doing take turmeric, some other health products to try to get some of the inflammation down, and not really too successful. I think it did prolong the decay a little bit, but eventually it was overwhelmed me with pain and stuff, so I couldn't do the things I wanted to do. Doing the program and the therapy and everything, my knee is 1,000% better. I get very little pain. Once in a while I get a little twinge, but I mean it's so minor that it's not even worth talking about. My right knee, the one that I had done, is better than my left knee right now. I water ski, I ride dirt bike, I jump, I dirt bike, and I land. There's hard impact on my knee, no issues. Bounce through the boulders on my mountain bike, no problem. I mean, I climb hills, nothing. So it's, like I said, it's 1,000% better, and I'm very happy with the results. I strongly recommend, if your knee's hurting, to really look at this, and because the alternative is not good. That's why. I mean, it was a little bit of money to have it done, but in the end, definitely worth it for me. I feel like my knee's a 30-year-old knee instead of a 50-plus knee. So I'm super happy, and I'd recommend this to anybody. Give it a shot.
So what do these guys have in common?
Injuries.
Injuries, right? Yeah. And they're all millionaires too, multi-millionaires. They can get health care anywhere they want. So Manning suffered a neck injury in 2011. He went to Europe. This is before we started doing it in the United States. Chris Johnson, knee injury, 2013. He had it done in the United States. Rafael Nadal, back injury in 2014. He had it done in the United States. We do not do back injections. That has to be done under X-ray, fluoroscopic X-ray. And so there are a couple of places that do it with modest success. We do not have modest success with joints, knee joints and hip joints. We have fantastic success. Kobe Bryant suffered a knee injury, 2011. He also had it done in Europe. So frequently asked questions. How long does the treatment take? It's really it's such a simple process that it's probably about a 15-minute procedure, and that includes cleaning the joint off and injecting. We have Dr. Dixon, who is an advanced joint injection specialist. He's fantastic at the process. He gets the material exactly where it needs to be so it can do its magic in the body. And it's really an uneventful process. People come in, they get the injection, put a little circle Band-Aid on it, walk out, assume normal activities. I mean, it's really that simple. How many treatments do I need? That really depends on the person. I'm looking at myself as just needing the one at this time. I don't see any need, and I pound my knees and my shoulder pretty good still. I'm still playing national and world-class softball. Some people, last year we did almost 100 injections. We had 4 people that we gave a booster to. They got good results, but they wanted better results, and now all 4 are doing fantastic. Out of last year, with almost 100 injections, we had 4 people it didn't work out so well with. Meaning they didn't get the results that they were expecting. We didn't get the results that we were expecting from them. But out of almost 100, 4 is not a bad number, except for those 4 people, unfortunately.
Was that the same 4 that needed the second injection?
No, the 4 that got the second injection are all doing fantastic now. Some people will need regularly